Now the question, would Dr. Bassem, would you treat this case with clear aligner?
I'm not
Oh,
sure.
no way.
No way.
I mean, I wouldn't. I mean,
Of course.
unless you're a hero and you want to show muscles and spend 4 or 5 years and then the patient gives up. When we sent this to clear aligner, to Invisalign, they said 90 aligners. And this is what I do. I tell my team, guys, send it to clear aligner. Even though we know that we're going to do hybrid mechanics, send it to them. Let's keep record. 90 aligners. Okay, great. With the anti-tip and the whole 9 yards. And we know what's going to happen, right? Then what we do, guys, is we extract, use segmental mechanics, start taking the canines back. So take the canine. I need you to pay attention to this. If your canine is rotated like that, your closing loop, take the mesial part. You're going to learn that in the course. Take the mesial part, put it on the inside, so that when you fully engage it and it goes back, it takes the canine back and it derotates. Then this is a different case, but I'm showing you this part of the wire should be on the outside, should be on the buccal, but we put it on the palatal side to be closer to the tooth until it derotates. Then I move it to the outside again. So that's a way within the 6 months, you can take care of rotation of the long axis of the tooth and the torque all in the same wire. And it's a very simple 1725 TMA wire. So you get to this stage, and what are the movements? I'm going to tip 1, 1, 2, 1, and 2, 2. Shift, then tip the lateral in. How many aligners after we closed? Only 32, not 90. And here with the aligners. And when you're retracting the anterior segment, use class 2 elastic just as an anchorage at night. And please be gentle. Use light force. And exactly step by step, procline, shift to the patient left, then pick up the 1, 2. And that's exactly what happened. Midlines on. And here is a case that even with fixed appliance is a very complex case. It was done in 32 aligners. Because we know what movements clear aligners are good at and what movements they are not good at. And we do not work for the clear aligner company. We work for our patients and for ourselves. And I tell you, why struggle? Little closing loop or a nitinol closed coil spring, slide that damn thing, close the extraction space, leave the anterior teeth free to drift. And that's how it is. So you can see we saw the patient every 4 weeks to activate the closing loop. Once we close the extraction space, we gave clear instruction, and voila, it's done in 32 aligners. One more case because it's Bimax, so you shouldn't be scared of Bimax. But let me show you. You see how much space here? Unless this central incisor goes on a diet, it cannot fit in that space. So we have to extract, distalize the canines. Well, I know that extraction space, I can't afford, it's already a high mandibular plane angle with an open bite. I can't afford to lose torque. I can't afford tipping. So what do we do? Hybrid mechanics. One visit, two visits, leveling and aligning. Extract, use the closing loop. As you distalize the canine, guess what? Dr. Bassem, how much space is here between the upper right lateral and the upper left central compared to pre-treatment?
Almost 5 times.
Exactly. Without a single bracket on the front. That 5 millimeter of space on 4 aligners per millimeter, that would have been 20 aligners just to get to that. And we addressed the patient concern, so we didn't put brackets on the front. Buccal segment, overbite, overjet. Okay. This is our last, guys. That's one of my team, Dr. Nick Leung. We extracted for first premolar. She's a Bimax. And the problem with Bimax and not severe crowding, and the only reason I selected this case for you guys is do not be tempted to believe in the clean check, because if you get dumping on a case like this, I'll tell you what, you have very minimal crowding. So when you extract, all the extraction space closure is coming from the teeth moving back into that space and the back teeth moving forward into that space. You know what? If there is crowding, when I extract, I can relieve crowding. That means there is less retraction. So if you cannot afford to lose control of the torque, don't use clear aligner that you know they have very weak torque control. What you ought to do is this. Segmental mechanics. And because it's class 2, I'm starting in the upper first, one visit. Then the following visit, I start on the lower. So we're using the hybrid mechanics. Take the canines back. Now I'm getting spacing. Look at the lateral. The central was riding on top of the upper right lateral. As I took the upper right canine, the upper right lateral with the transeptal fiber, under the pull of the transeptal fiber, it relieved the crowding and it's not wedged under the distal of the upper right central. So now the clear aligner, all it has to do is tip the distal palatally, tip the lower segment back because the teeth were proclined, and then only 34 aligners. It's a simple tipping, and we know that clear aligner is good with the tipping. So we're accepting it. Clear aligner. So look at the dates. We started March 2019. September, the 6 months, we removed the brackets. Send the case for clear aligner. And then we finished December 20. So from September 2019, we removed the brackets, did the scan, send it, waited for the clear aligner. Treatment from August, we finished March to December. Bimax case, and look at the soft tissue change.